PCOS, Polycystic Ovary Syndrome. Women very often use this term, but how many of us know that PCOS is an issue that affects 1 in 10 women of childbearing age? If any female is facing infertility issues or delayed periods, then chances are very high that she might be suffering from PCOS. To debunk all the myths related to PCOS and answer important concerns and causes of the same, we reached out to a gynecologist who has shared some important insights.
Polycystic Ovary Syndrome is a complex metabolic and hormonal syndrome which leads to a variety of syndrome in a woman, and it is mainly caused by the androgen axis, or you can say the male hormone axis in the body. So usually the polycystic ovarian disease and the polycystic ovarian syndrome are used for the same disorder, and obviously they both are same, but if we look at the etiology, then yes, we can say the polycystic ovarian syndrome differs from the polycystic ovarian disease. Otherwise, in a layman language, they both are used for the common syndrome. So, polycystic ovarian disease is one of the reasons for irregular periods. But if we say that if you have irregular cycles, then it is only because of polycystic ovarian disease, then yes, it is not true, because there are other reasons which can lead to the irregular cycles. And to name few, most common are the thyroid disorder and high prolactin levels. So not everyone who is suffering from polycystic ovarian disease is overweight. Of course, the polycystic ovarian disease leads to weight gain because of the metabolism which is abnormal. But the polycystic ovarian disease is also seen in thin women or the girls. And let me tell you that if a thin or the underweight woman is having polycystic ovarian disease, it is quite difficult to manage. So one of the symptoms with which the polycystic ovarian disease women present with is infertility, which is difficult to conceive. But saying that, it is not the only reason for infertility, as it leads to anovulation and the menstrual irregularities. That is one of the reasons for infertility. So as I said, that the polycystic ovarian disease leads to the male hormone axis production, and this excessive male hormone leads to acne. But there are other conditions as well which can lead to acne. So we have to do a detailed investigations in the form of hormone test and the blood test to rule out polycystic ovarian disease as one of the reasons for acne. So there are different risk factors where we can predict that the girl or the woman is going to have polycystic ovarian disease in future, and to name few are if somebody has got a central obesity, or if there is a history of a premature delivery, or a woman to polycystic ovarian disease mother, if there is a evidence of insulin resistance in the body, then these conditions can predict or can lead to the polycystic ovarian disease in future. Lifestyle management or the lifestyle measures are the key factor nowadays for the management of polycystic ovarian disease. And it is being seen that polycystic ovarian disease does not have a short-term effect on the body, but it leads to long-term effect as well. And to name few are the risk of diabetes, risk of endometrial cancer, hypertension, and high cholesterol. And the lifestyle measures are the mainstay for the treatment of polycystic ovarian disease, mainly in the terms of regular exercise and diet modification, and keeping your BMI in the normal range.